IV piggyback drug administration. There's some systems that are generally used with the piggybacks. You have your standard mini bag where the pharmacist will add the drug to the solution. You have a pre-calculated packaged system that contains the diluent and the drug itself. And a couple of examples would be your Advantage systems or your Mini Bag Plus systems. The infusion time of IV piggybacks is generally about 30 to 60 minutes, but on occasion it might be longer. Every now and then you will have for example, vancomycin or gentamicin is usually mixed in a 250 ml bag versus a 100 or a 50 ml bag, and those require a longer time to infuse. Commonly employed modes of delivery is usually done during the pressure sensitive check valve set when a secondary set is used, and this will basically require a demonstration during your clinical lab time. But basically it is when you're infusing a secondary set without the use of a pump. You have your mainline IV fluid, so it's usually a 1,000 ml bag, and you have that piggybacked into the upper Y port of the administration tubing. You put the mainline IV bag, the bigger one, at a lower level than your secondary or your piggyback drug, which is, for example, usually an antibiotic. And the secondary line will infuse, and due to this pressure sensitive system, etc., the primary will not be infusing while the secondary is infusing, but when the secondary is empty, the primary automatically kicks in. The thing to remember with this type of system is the flow clamp of the short secondary medication administration set is considered strictly an on or off clamp, and it should not be used as a flow regulating clamp. So, principles applicable to each mode of IV piggyback delivery. You need to check the label on your piggyback container against the physician's order to make sure that you have the correct drug in the proper dosage, and that's what will be administered to the patient. You need to determine that the integrity of the container has not been compromised, and always check the expiration date. Before you initiate the piggyback infusion, confirm again patient identification and make sure that you do have a patent IV site. Always wash your hands when you're doing IV therapy. Determine compatibility between the piggyback drug and, for example, your mainline fluid, or if you have a locked cannula, was it locked with normal saline or was it locked with heparin? Because if it was locked with heparin, then you'll need to determine the compatibility of the piggyback with heparin. But usually, and you will be trained to flush your lines with saline prior to the administration of a drug. Flush your primary line with normal saline if there is a bioincompatibility, and then you shut it off so it will not infuse. Effectively disinfect the injection port of the primary line between the connecting IV piggyback system. The agent will depend on the facility's protocol, but frequently it's your isopropyl alcohol and sometimes it's the povidone iodine. Secure the IV piggyback or the primary line connection with tape, or make sure that it is appropriately secure with whatever device you have. Adjust the flow rate of the piggyback infusion in accordance with the order and the drug manufacturer's recommendations. When you are using that primary pressure sensitive system that I just discussed, again, to make sure that the system works effectively, your primary container will be lower than your piggyback container, and you will adjust the flow rate on the primary tubing. The secondary set will not be detached from the primary set after that piggyback delivery normally, and you exchange or replace that empty piggyback container when you're hanging the next piggyback drug.